let's fix documentation, let's fix, whatever. It was more, how do we bring technology alongside the clinician so that without adding friction, but in essence, removing friction through an ambient environment and experience.
Hello, this is Zach with the American Journal of Healthcare Strategy, and you are listening to the Clinicians and Leadership podcast series, where we focus on empowering clinicians from bedside to boardroom. Today, I am joined by Dr. Stephanie Lahr. Dr. Stephanie Lahr, do you mind taking a second to introduce yourself? Tell us a little bit about your experience and your current role and how you got to where you are today.
Yeah, absolutely, Zach. Thanks for having me here today. Really looking forward to the conversation. So I'm an internal medicine physician by background and training and practice. I have been in, the health IT space for probably more of my career than my clinical practice, or at least getting close to that at this point. But it certainly wasn't strategic. I started off as a hospitalist and was engaged by the leadership of the organization that I was working at to get involved in IT, mostly just because I had some thoughts and comments. And they said, well, gosh, if you're willing to share those thoughts and comments, we'd love to listen to them. And so it kind of evolved organically. I then got board certified in clinical informatics as I found that this was an area of specialization where I could know and learn more and be a bridge really between the clinical side and the technology side. And then had the benefit of working for a couple of mentor leaders in technology that took me under their wing to help me understand really more about the deeper technical side to bring those synergies together further, such that then my roles evolved from being clinician to clinician and informaticist to then a CMIO. And then most recently, before my role that I'm in now, I was the CIO and CMIO at Monument Health in South Dakota, and was able to lead really the totality of what that organization was doing from the perspective of strategy and deployment for all of technology. So it's been a winding road, but it's been a wonderful one, and really a lot of that drive has come from that commitment that I have around bringing the joy back to medicine for our healthcare clinicians. And so along those lines, a couple of years ago, I had the exciting opportunity to meet with the CEO of the company I now work for, who is another clinician, founder, and CEO. And he was bringing something forward to really shake up the way that we think about the delivery of care and the workflow, and trying to think about new ways to bring automation to the bedside. And I was very, very excited about it. Got engaged with him from a customer perspective. And then, we kind of continued the conversation, and he said, gosh, with all this excitement that you have, maybe you should be a part of our team. And it really was, for me, I felt like an opportunity to go from, at the bedside, helping one patient at a time, in a leadership role in an organization, helping a community at a time, to then moving beyond and really being able to contribute to the broad ecosystem of healthcare today.
Well, Dr. Lahr, we're thrilled to have you on today. Just to excited to hear your thoughts and your perspectives on a variety of things, and I'm particularly excited to hear your thoughts just on the impact that technology can have on healthcare systems and on workflow and on a clinician's experience working there. But before we get into that, something you just said in your introduction was very interesting to me, and you emphasized the importance of bringing joy back into healthcare and joy back into medicine. What does that look like in today's healthcare environment, and what are some things that have caused that joy to be eroded over time?
Yeah. It's a great question, and maybe the best way to answer it is, what does joy not look like? Joy definitely doesn't look like clinicians, whether those are physicians, nurses, therapists, anybody in the clinical environment who has really dedicated their career to caring for patients, to spending more of their time on everything other than the care of the patients, and not having the tools that they need to drive the care. If we look back, the writing has been a little bit on the wall that we were headed down this road for quite some time. There's a very famous picture in JAMA from the 2010 era when meaningful use was coming forward of a little girl in an exam room who had drawn a picture, and her doctor was facing the computer with his back to her, and she was on the exam table. And he was alarmed and concerned about this changing dynamic between patients and their clinicians because of the adjunct of bringing technology in. And yet, we have to have technology. The amount of information that's available to support clinical care, to drive clinical advancement, to drive precision care, to make sure that every patient gets what they need when they need it, is becoming more and more voluminous and powerful. We don't have an ability as humans to consume the amount of information that is both available in a patient's history as well as from a perspective of evidence-based medicine to address their care. So we're going to need technology in order to drive that. But the ways in which we got started in implementing it were not really driven by the idea of building it alongside our clinicians with workflow in mind. It was more driven to the outcomes that we were looking for. And the reality was too that technology wasn't advanced enough yet to do the things that we really needed it to do, and we needed to build some foundations first. So I think what's really exciting about where we are today is health systems across the country have built an amazing foundation through EHR implementations, ERP implementations, PACS system implementations, all the technology-based infrastructure to support the bringing in and documentation and leveraging of the information. And now have an opportunity to use more advanced technologies with artificial intelligence, large language models, computer vision, et cetera, to layer on top of that ecosystem that's been built to drive toward workflow. And what we're going to have to do in order to do that is engage the clinicians in that conversation.
There's a lot of really good, interesting things that you said in that answer. One of the things that I think you walked through brilliantly was seeing how technology is often a problem and a solution in healthcare, and it has a unique thing where it's viewed as both in different situations and by different individuals. What do you believe in your experience differentiates technology that helps from technology that hinders?
Yeah, I mean, I don't think it's as black and white as that. I think that there's a lot of technology that can be helpful, but it's not always deployed in the most effective way. And I think that part of the reason that that has happened is because until very recently, there was quite a divide between technologists creating technology and bringing it to the bedside and sort of hoping that it would work out. And the clinicians were sort of secondarily involved in making that happen. And I think, what we see in the tools that are really taking off right now and bringing some of that joy back, the companies that are creating those tools have engaged clinicians either as a part of their own teams or through user group and advisory boards to understand the workflow and the complexity of a healthcare environment, and then figuring out how those tools that may need to do certain things can be built into the workflow to support that best. And so, again, there are certain tools that we are going to have that we need to use to support the general infrastructure. But I think there's a lot of opportunity to go back and either layer some additional elements on or tweak some of those things with a clinician workflow and mindset.
So, Dr. Lahr, your experience both as a physician and a CIO and a CMIO, I think offers some unique perspectives to this next question. And you talked about it a little bit before, but you have your physicians and your other clinicians who have gone through extensive years of training and schooling to take care of patients and serve in the medical side. So those are your medical professionals. On the other side, you have your IT professionals and your IT leaders that have gone through years of training and schooling and fully understand the capabilities that technology has to offer. And often those two professionals, groups of professionals, are speaking different languages and trying to collaborate. And I think your combination of experience as a physician and a CIO offers you this unique perspective on how your clinicians and physicians can collaborate with those IT leaders more effectively to drive this meaningful change. How can they collaborate more effectively?
Yeah, I think there's a couple elements to that. The first thing I would say is, the advent of clinical informatics, which has actually been around for quite a long time, but adopted more on the physician side and more in the mainstream versus just a traditional academic perspective and environment in the last decade or so, I think is a really important part of this because people who have additional education about the intersection of those two things can be a bit of a translator. The reality is, while we want to engage clinicians with the technology teams to ensure that we are thinking about workflows and the complexities of care delivery in the tools that we're creating, we don't want to do that so much that they can't focus on just delivering care. We have to have nurses and doctors and therapists delivering care every day. So we can't have all of them spending a huge amount of time working with the technologists. And similarly, we can't be sending the technologists to the bedside to learn and understand all the deep complexities of healthcare because they need to be working on building and refining the technology. So having a cohort of people who have specialization in being able to bring those two languages together, I think is a core element and why we're seeing a lot of health systems, large, small, and otherwise, make investments in an informatics team that can help be the bridge between that so that we can engage clinicians for that are actively practicing nursing, medicine, et cetera, in some detailed conversations but very specific around the work and the problems they're trying to solve, and then extract them out of it and get them back to their care delivery environment, and then have those interpreters go back to the technologists and sort of be that bridge back and forth. I think there's some of this too is just the recognition that these are two distinct areas of expertise, and that in an organization we need to find ways to bring those together. I would say that I think the organizations I've seen be most successful at this, and I would speak for the organizations that I've worked for, have elevated the technology role and the physician roles of leadership both to be directly reporting to the CEO and consider them strategic. And so if the strategic leaders over technology and the clinical side are in the room together having, those senior executive conversations around all of the complexities that go into healthcare delivery, not just clinical medicine and not just the technology, but everything else that goes into running a healthcare system, it really allows for those conversations and the deep understanding of those two areas and the expertise to broaden. So again, I think, the main thing I would say is informatics is really, really important. Mutual respect is really, really important. And trading places and doing some work where technologists are going into the clinical environments and equally the clinicians are coming to the table for conversations and understanding more about what the technology is capable of are the key elements to success.
Yeah. Well, and I would just add leveraging individuals like yourself that have that extensive experience and interest and passions in both of those fields offers just some invaluable benefits to a company and to a healthcare organization. Kind of going off a little bit what you said, just recognizing that healthcare systems are making more investments into the informatics side of clinical care and healthcare. Other companies are stepping up as well to help fill the gaps where those healthcare systems maybe aren't as sure where to the next steps to take. And so I want to talk a little bit about your role at Artisite and how they are at the forefront of solving challenges in our healthcare systems that our healthcare systems are facing, that your clinicians and physicians are facing. So what, I guess to start off, what differentiates Artisite's approach in solving these issues, whether that's clinician burnout or other issues that clinicians and healthcare systems often face. What differentiates their approach from other solutions in the market currently?
Yeah, I think you're right. There's a lot of really great attention right now around the idea of technology coming to the bedside and, again, bringing the joy back to medicine, offloading high friction, challenging workflows for our already very busy clinicians that have more work to do clinically than there is time to do. Artisite, as I mentioned earlier, foundationally is a company that was built by clinicians for clinicians. We are inherently knowledgeable and deeply tied to the workflows and the complexity and the challenges of care delivery. We've each, in our own ways, lived through various challenges of trying to deliver care and seeing what those challenges are. And I think then what's really unique about us is when Andy and our two other founders created this company, it was this idea that first, the promise that technology could make it better, but we had to think about it very radically differently. And when I first met him and he said, we're going to use computer vision in healthcare spaces to help, create automation for clinicians. First, to be perfectly honest, I wasn't even really sure what that was. Then we started talking about self-driving cars and those kind of, I was like, oh, okay, I'm following you now. And then, really the perspective that he took, which was so unique, was we as humans, we as clinicians have various senses we use. We see, we hear, we speak, we feel things, we know where things are in space. Clinicians are using those senses all of the time. A lot of the work that needs to be done, the information that needs to be captured, the data that needs to be aggregated, can potentially be captured through sensors that do those things. And so the concept was not, what is this, one slice of a problem that we can do? Let's fix documentation. Let's fix, whatever. It was more, how do we bring technology alongside the clinician so that without adding friction, but in essence, removing friction through an ambient environment and experience, how do we do some of the seeing, the hearing, the speaking, and the knowing where things are, replicate those senses with technology sensors, and then bring that information to the clinician to be able to leverage. And so, again, the fact that we're built by clinicians and had that focus, the fact that he went out and found amazing AI scientists and engineers with deep understanding of computer vision and other AI technologies to build a foundation of that. And then the idea that this would be a platform approach that could extend across a healthcare environment, whether we're talking about inpatient, whether we're talking about ORs, whether we're talking about clinics, whether we're talking about helping nurses or physicians or therapists. This platform concept allows, from the technology perspective side, for a one system to solve many problems. And that's, one of the challenges I always saw as a CIO was there were a lot of individual products that were great at solving problems, but I couldn't keep up with this individual, solution at a time to solve each and every problem. I needed to solve more problems with one tool. And so, all of that together, I think really has brought us into a unique space. The final thing I will say is we see ourselves as a transformation team, not a technology team, which means that we are at the table with the health systems that we're partnering with to ensure that we're not just delivering some tech and walking away, but we're really helping them walk through what does leveraging this kind of new technology, which we've not done before in a healthcare space, need to look like, and how do we make that work in their environment the best. And it's really been very exciting to have that kind of collaboration because we get a lot of amazing ideas from our customers and a lot of synergy going back and forth on therefore what to do next.
Well, and that's it's encouraging to hear that you've mentioned just the variety of products out there, and there's a lot of really good products out there, but often your physicians are left to kind of fend for themselves when it comes to the implementation and the usage of those products effectively. So it's encouraging to hear there's companies like Artisite that are staying at the table and walking you through how to use this effectively. And I loved how you described it as a transformative team. And not just delivering a product, but delivering a product and educating and informing and teaching how to use that product effectively. I think that's fantastic. So, couple final questions, and then we'll let you go. As a former CIO and CMIO of a health system, what are some tips that you offer healthcare systems that are looking to implement these new technologies? I think that your combination of experience as well as your current role offers you some unique perspectives on this. So I'm just curious, some tips for those healthcare systems that are looking to implement new technologies.
Yeah, I think first of all, start with a problem, not a solution, right? There's a lot of solutions out there, a lot of technology, and they are very good solutions, but they may not be the right solution for your own environment at that time, depending on the problems that are most challenged and facing your particular organization. And so I think it's always start with the problem and not the solution. The way to know what those problems are is to engage the end users. In a technology environment, in a health system, obviously, a lot of my focus has been around, especially in my work with Artisite, around what we can do for the clinician. But there are lots of other folks that support the delivery system. There's, the revenue cycle side, the data management side. There's a variety of other pieces that they need support as well. So it's making sure that you're in contact with whoever those end user constituents are, including patients, to identify the right problems that within your own organization and your own community need to be solved. And then I think the last thing I would say is you've got to be willing to take some risks. They need to be calculated risks and they need to be structured risk. But there are some really cool and unique opportunities out there to work with health or to work with health solution providers that are bringing new things to the clinical paradigm. And you may need to we're going to have to do things differently than we've done before. And so in order to do that, it's going to have to have a bit of a creative mindset and a willingness to take some risk, think about things differently, leverage innovative ways of thinking, but then ensure that you've got enough guardrails around those risks that if you do have some failures, they're small failures and you can rinse, repeat, learn, and move on.
Well, Dr. Lahr, I'm grateful for your time today. I have one final question, and then we'll let you go. And I want to circle back on this final question to something that we talked about really pretty briefly at the beginning of this interview, and that's just this importance of joy, really in life, but especially in healthcare, and just kind of the erosion that joy and individuals erosion of joy that's happened in the last number of years. I'm curious to hear your thoughts on how you see the role of leaders in restoring that joy, as well as any advice that you may have for your healthcare leaders that are seeking to create environments for their clinicians where those clinicians can thrive and find joy in their work. So I'm curious if you have any thoughts on those things.
Yeah. Yeah, I think, the role of leaders is crucial in this. They have to um, be able to create a vision that it's possible, but they also have to help people understand and be transparent that it's going to be a journey. We didn't get here overnight, and we're not going to unwind some of the elements or add new elements for supporting these things, in a snap. So that transparency, the empathy, the acknowledgement, but also creating the vision that we will get there and can do that together. And then back to that last comment in my previous comments around having an innovative spirit and willingness to be creative. The reality is, leaders that have an opportunity to champion this have to do so. They have to make this a priority. They have to find a way to express the value that this can bring to an organization in ways that will resonate. And those are going to be different than our traditional ROI metrics. But if you can find a way to express that, bring that into an organization and set that vision, we've got to do this. It's not an option anymore. And so it really is going to take leadership in order to get us from where we are to where we need to be.
Well, and I love how you describe it as a responsibility that leaders have, not necessarily just an opportunity or an option, but it's something that must be pursued and must be pursued vigorously. And I think that that's a sweet perspective that we need more of. I think that there's a lot of focus on an individual's pursuit of their own joy and a work life balance and things that can be done to do that, and not wanting to take away from any of that, because obviously that is very needed. Yet there are things that leaders can do that can help promote that, and I'm encouraged to hear from you as someone who has done that and who's doing that. It's encouraging. So Dr. Lahr, I appreciate you joining us today on the Clinicians and Leadership podcast, and we wish you the best.
Yeah, thanks so much, Zach. It's been my pleasure. Take care.